Okay, I've had the message saying we're live, so
Right. Okay, thank you, Chair.
yeah.
Yeah.
So we will make a start. So welcome everybody to the June meeting of the Health and Wellbeing Board. Anyone watching the live stream, my name's Tim Swift. I'm the Deputy Leader of the Council and Chair of the Health and Wellbeing Board. I ask people to introduce themselves when they speak on an item rather than go around everyone at the start. But I will have one or two people here for specific items. So Frank Swinton for the community care item, Marianne Huyson for the adult safeguarding board, but obviously also welcome to comment on safeguarding implications of any items on the agenda, Marianne. So item, do bear with me. I think you have one or two changes of membership and substitutes, so I'll apologise for not running through all of those. But Janet, can I just ask first of all for apologies and substitutes nominated?
Right, okay. Chair, Anna Basford has sent her apologies and her substitute is Lisa Williams. We have a new representative from the police, which is Chief Superintendent Dan Hayes.
Welcome, Dan.
Yeah. Morning, Chief Inspector. You promoted me a couple of times.
However, sorry, I thought it was Superintendent. I will change my records.
Always better to promote you than the opposite.
Right.
Okay, and so at risk of getting wrong, I'll welcome Councillor Abigail Carr as a new member from the Liberal Democrats, newly elected councillor. So welcome, Abigail. Do you prefer Abby or Abigail?
Yes, I'm Abby. I feel I'm being told off. Okay. So yeah.
Okay. And also welcome Joe Bibby, who is the new independent chair of the Calderdale Cares Partnership Board. Welcome, Joe. So item 2, members interested. If I can just remind members, as always, to declare any pecuniary or prejudicial interests you may have in any items on the agenda or particular interests. Item 3, admission to the public. There are no confidential items, so not proposed to exclude anybody. Item 4 is the minutes of the meeting held on the 9th of March. So could I just check if people will be happy that I sign those as a correct record? I'm not seeing any signs of dissent, so I will take that as read.
We have a proposer and a seconder for those.
Sorry, I'll propose it. Could I have a seconder? Councillor Monteith, thank you, Brenda. So that's agreed. Item 5, question time. Janet, Mike, I don't think we're aware of any public questions, are we?
I've not been made aware of any, Chair.
No, me, Chair.
No. Okay. So item 6, West Yorkshire Healthcare Partnership Climate Change Strategy. The report's been circulated. Can I welcome Frank from who is the Partnership Climate Change lead? And Frank, can I invite you to introduce this item?
Yeah, thank you very much, Chair. Good morning, everybody. My name's Frank Swinton. I am the climate change lead at West Yorkshire ICS Partnership, Healthcare Partnership. I'm also a consultant anaesthetist at Airedale Hospital. And I've brought this strategy and menu of proposed actions to you today for several reasons. One is that we took it to the partnership board back in March and we were asked to bring it to the health and wellbeing boards of the places within West Yorkshire. So that's the sort of formal reason that I'm here. One is to highlight to you that this work is ongoing and to offer help if we can provide it. One is to highlight the work that I know several of you on this call have been doing for a long time. Specifically, I'm looking at you, Debs, and talking about the work you're doing on adaptation, which is really important. That's the next iteration. That's the sort of next thing that we need to think about is, so climate change is happening. What do we need to do to change our services so that they're fit for the purpose, fit for the future? And they, you know, they don't fall over every time it rains or gets too dry. Really, that's about it. So, are you happy with what we've proposed? How can we help? Thanks for your ongoing work, and please keep in touch. So, I'll open to questions if that's okay.
That's fine, Frank. Given there has been some change of membership, I mean, it's perhaps just helpful just to remind people who are less familiar with the health system, with the background to this, that the West Yorkshire Health and Care Partnership brings together all the health organisations across West Yorkshire, but also local government and other partners as well. So in any strategy at kind of a partnership level, it's kind of discharging two things, really. It's influencing what the ICB itself as a director, employer and commissioner does, but also looking to build a shared commitment from all of the partners to what we do. And we're very much focused on that kind of collective leadership. It's not a top-down model. So discussions like this at the Health and Wellbeing Board is an important part of making sure that this reflects all our ambitions and shares there. And of course, climate change is huge for the NHS, both because actually health and health-related activities are a big contributor to climate change, but also, of course, it's got huge implications for future health as well. I've also invited Councillor Patient to join us, who's Calderdale's lead for climate change. So, Scott, I'll bring you in at an appropriate point if there's anything you want to add. So, is there any questions or comments or contributions people want to make on this point? Debs, you're given a little lead in by Frank there. Do you just want to say a little bit about the adaptation work?
Yeah, I was waiting, Councillor Swift, to see if anybody else wanted to come in first.
We're all very polite.
There were two things particularly that I wanted to sort of mention, I guess, in relation to this report. The first thing, I'll come to climate adaptation second, if that's okay. The first thing is just colleagues on the call will be aware that Calderdale's developed a draft climate action plan, which we've gone out to consult on very widely. We've had the results of the consultation back, and we've been doing some work to reflect the feedback that we've had from a wide range of partners and members of the public into the next iteration of that climate action plan. That I think there's potentially a useful task for us to do, to look at the actions in as a system. It's a multi-agency climate action plan, is to look at the actions in Frank's report and just check how they are picked up. I believe they are, but check how they're picked up in the emerging next version of Calderdale's climate action plan. And I think that'd be useful. I feel that the climate action plan that we're developing, and Councillor Patient will probably want to come in as well. We've got representatives from the NHS, the voluntary and community sector, local businesses, obviously the council, all working together really on that climate action plan, and I think that cross-reference really between Frank's work and that will be really useful. And then the second, and link to that, one of the things that we talked about at our last meeting of our climate action partnership was some of the key cross-cutting themes that potentially contribute to all of the outcomes we want to achieve through our climate action plan. One of those was climate adaptation. One's climate justice as well, which I think talks very much to the sort of health inequalities agenda as well. And in terms of climate adaptation, what we've been doing in Calderdale, we've been working as part of the Yorkshire and Humber Climate Commission as part of their climate adaptation programme. So we've been doing some work to explore how we can how climate adaptation can be reflected in our climate action plan, some work about how we as a council reflect and assess and understand climate risks, so the risks of climate change on the way we work as an organisation, on need for our services and the way that our services are delivered. So we've been doing some work on that. And then the final element of the work that we've been doing is looking at developing a service specific climate adaptation plan. And we tested that on public health services, which has been incredibly useful, and we've learned a great deal from doing that, and that's what Frank's referring to. And as part of that, obviously, some of our public health services are provided by our healthcare providers, you know, healthcare partners as well. So we are looking to sort of write that up and reflect on and summarise the lessons for that, and make sure that they're shared with both the Calderdale Cares Partnership part of the world, but also through to our organisation and potentially through to some of the partners that are working on, you know, delivering our climate adaptation plan. So, and I think there's again some lessons, Frank, aren't there, to be learned on that for our integrated care system and integrated care board as well.
Thanks very much, Debs. Scott, can I bring you in next?
Yeah, thank you. Thanks, Tim, for that. And that's really helpful from Debs, I think, to outlay the work on adaptation, which I think is going to be the key next critical test for all of us, really, moving on. I just want to say thanks, Frank. It's a really good piece of work, and I think the ambition's really good, particularly as it goes to 2038, which, as you'll know, sort of aligns with not only our target, but the combined authorities as well as Greater Manchester and more widely. So it feels like that synergy is really, really baked in, and that's important. And I think you going out and hawking it, as it were, to groups like this is an important part of developing partnerships and buy-in. I guess more broadly, and these aren't challenges, these are more asks and just sort of musings, really. And I think, as you know, NHS are part of our climate action partnership, as sort of Debs has alluded to. But I think it might be really helpful if increasingly we are finding, and it's a journey, that still, even though it's a partnership, people are increasingly looking towards the council for answers. And I think stuff like this, for particularly for members of our climate partnership, which is a broad membership cohort, understanding and knowing what is happening in organisational sectors outside of the council will be really powerful. So that's just a broad open invite to perhaps come and speak to the partnership, or even to our officer forum, really, to get some of that buy-in and to really help us spread the work of what's happening on a more strategic basis. I do think, and what I am interested in though, is what work's going on with different partners and stakeholders, and I'm thinking like voluntary sector and other adjacent groups who might be able to leverage different levels of funding that perhaps the NHS and trusts can't, because that's, I think, going to be a key part of making sure that the work you do here is A, understood and amplified throughout different organisations, and B, you can also get that funding, which is going to be key to deliverability outside of the areas that you can touch. But really good plans. So not real challenge, just some thoughts, really.
Thanks, Scott. Frank, do you want to come back in on?
If I may, thank you. Yeah, thank you both. I'm sorry if I get people's names wrong. Scott, Councillor Swift referred to you as Councillor something, but I can only see Scott P.
Scott works. Scott's what I prefer.
Okay. Thank you. Yes, very happy to come and talk to you in the council about what's happening elsewhere. Either myself or somebody from my team at a sort of a whole West Yorkshire level in health and social care, or if you're not already connected to them, some of the people working on sustainability in your healthcare providers. That's easy to organise. Let me know. And secondly, what's happening with other sectors. The answer is there is some really good work going on. We've done some work. So as an example, we're currently completing some work looking at the footprint of hospice care and end-of-life care, which, as far as we know, and we're looking at a couple of hospices in West Yorkshire, and as far as we know, that's a global first. Nobody's thought about that, and that's due to be published very soon. But there are huge other tracts of health and social care where, to be honest, I don't know what's happening. There's some great stuff happening. There's some areas where there's not much happening. And the reason that I don't know is because the system is massive and complex and my resource is minuscule. But therefore, the intention with this strategy is that it is incorporating all of the system and all of sustainability, but in a way which is not didactic. It's, you know, hey, we're going on a journey, please come with us. You can pick this up even if you haven't met us, and do something somewhere and or get in touch. That's a bit of a non-answer, but it's the best I can do, I'm afraid.
Yeah, and I just wonder. Sorry to jump in, and I see one of the admins has cheekily changed my name to Councillor Scott Patient there, which is funny. Yeah, I mean, we increasingly, one of the challenges we get is, you know, tell us about the work that you're doing, and that's what environmental activists will say. And we're doing a little bit of work at the moment in terms of taking stock around the work that has been achieved, not just within the council, but like through partnerships, and trying to present that almost in a way to sort of appease some of the voices, but also so we can look at the achievements in place. So I wonder if there might be a parallel piece of work where you guys are able to do something similar and say, here's what's going on, because that's brilliant what you've just mentioned to me. Where would I find that information in the public realm? Where do you know what I mean? So I wonder if there's an opportunity to just link up, perhaps through Debs and I and yourself and partners, to make sure that we're really pushing out that work, and that, as you've just said, global first stuff that's happening. I think we've all got things that we've done first and we need to shout about it.
Yeah, so a one-line answer is that the annual report for the Improving Population Health Board at the Healthcare Partnership is as close as we've got to answering that question for you, because climate change sits within Improving Population Health.
Thanks very much. Jo, and welcome again.
Yeah, hello. Thank you. I wasn't sure if I could ask questions, but hopefully that's okay. Thanks, Frank. I'm the new chair for the Calderdale Care Place-Based Partnership, so this is all fairly new to me. I just wondered if you could explain a little bit of, if this is a kind of West Yorkshire-wide strategy, how do you anticipate organisations at place level translating this into kind of actionable and measurable plans?
So it's complicated. You won't be surprised to hear. As I said a little bit to Scott a moment ago, the intention is that, as with everything in the partnership, the healthcare partnership, the stuff that is best done at place should definitely be done at place. And so all the nuanced stuff around your geographies, your communities, should definitely be done at place. There are, what we have established is several networks of similar sort of professional networks. So we've got a network of all the sustainability officers working in health and social care, for instance, and they meet once a quarter to share ideas, share resource, share frustrations, etc. I think the metrics are, to specifically answer that question, are difficult, partly because they're so place specific. The obvious thing to talk about is carbon footprint. And within the NHS specifically, there's a really clear framework for the way in which that data is collected and represented, which is at a trust-based level currently, and that's aggregated nationally and then sent back to us. And as far as I know, that's in the public domain, that carbon footprint for trusts. But if it's not, then please let me know and I can send you a copy. Does that answer your question?
Yeah, that's helpful. Thank you.
Thank you.
Thanks very much, Joe. And just highlight for anyone who's not got the chat up, the comment that Dan's put in about the West Yorkshire Police Green Police Network. It's really helpful. I've got Abby, Councillor Carr, and then Debs.
Thanks, Tim. As the NHS Trust and the council, we commission millions of pounds of services every year. Are there any climate issues that are built into those contracts?
I'm sorry, your sound broke up. Are there any what?
Oh, are there any climate sensitive issues that are built into any of those contracts at that level?
So I can't answer for the council, but I can tell you that I can see Councillor Swift nodding his head off. But there is a strong framework for sustainable procurement within the NHS. That's had a new strategy launched within the last month. It's called the Evergreen Framework. Now, not all NHS procurement has to go through the Evergreen Framework or through the NHS procurement. So again, it's slightly complex, but yes, I mean, the short answer is yes. There is an NHS-wide commitment to only do trade with businesses that have a green plan for managing down their carbon footprint, which up until this year has been only for contracts above £5 million, but I think after this year includes all contracts with the NHS. Again, I'm sure there are some loopholes, but by and large, yes, the NHS really is getting to grips with its supply chain. And there is the Yorkshire and Humber, I'll get this wrong, the Yorkshire and Humber Climate Commission, which Debs has been working with, has a sustainable procurement arm, which they're currently recruiting to, and so they're encouraging everybody to sign up to that. I only heard about it yesterday, which is why I'm a bit vague on that, but that's something which we'll be looking at in the next few days.
Thanks.
Thank you.
Debs?
Yeah, just I didn't put my hand up for that point, but just to comment on that, I think there is something about those different levels of geography. So obviously there's some work at a Yorkshire and Humber level, sort of enabling us to work and understand some of these issues, share good practice. Then there's obviously the work at West Yorkshire level through both the Combined Authority and the Integrated Care Board, and I think also in relation to procurement and sustainability, there's something about what we do locally, I guess, as a partnership in Calderdale, but also as individual organisations. So again, that's something we'll be exploring, how we sort of connect to the Yorkshire and Humber Climate Commission from a Calderdale perspective, the work they're doing on procurement as well. The reason I put my hand up was to ask a question of Frank about, you mentioned that the sort of measurements of carbon emissions and progress is being made at a trust level. Are there any plans to expand that so that we're measuring a broader level? I'm just thinking of integration, moving towards much more integrated systems with primary care, with organisations that aren't part of NHS trusts, I guess. Are there any plans to understand and monitor progress in relation to those issues?
It's an entirely reasonable question, and the answer is not at the moment, because what we have at the moment is this soup of different methodologies, different people's interpretation of the rules, different goals. It's a bit of a sort of wilderness out there at the moment. It's very slowly, the world is forming consensus about footprint, not only carbon, but also things like biodiversity and ocean acidification, etc. And so there is convergence, but it's slightly slow and painful at the moment. And my approach to that is to not get too hung up on it, because I feel like West Yorkshire as a unit is not in a position to be able to drive that convergence. for lots of resource, knowledge, expertise, time, etc. Reasons. And therefore, unashamedly, I'm slightly sitting back on the whole idea of metrics to see how it converges, but it will happen. It is coming. I suppose the other thing to say at that point is that the proposed tool for decision making primarily, but metrics in time, in the strategy I've brought is to use the donut economics model, which has been adopted by lots of regions such as Cornwall, the city of Amsterdam, for instance. And so they're using that primarily as their decision making tool, but in due course, as the metrics become available and more robust, that will be a method for collecting and visualizing the data as well.
Thanks very much. I think as the meeting goes along, that there are some incredibly complex choices to be made about the relationship between climate change and how we manage our services. And I was just thinking in terms of home care, for example. I don't know how many people in South Aram have multiple visits from home carers during the day, all provided by different agencies, I suspect, all at different times. Nearly all of them using cars because the carers won't live in the village, and using the buses is not a viable option. I'll also, Frank knows about this because I emailed him, I'll wave around. I'm old enough to remember the days when medicines came in little jars, and of course now they all come in these things, oil packets. And I fell for a bit of what I think was greenwashing by a company, because I won't name them, but I saw that someone was saying you recycle these, but you could take them into their shops. But I discovered actually, if you take in a couple, they will recycle them. But if you take in like a bag full a week, which is what some of us generate in medicine oil containers these days, they don't want to know. So I sort of looked into why there isn't a recycling scheme and asked our recycling people. And of course, they are incredibly difficult to recycle because they're a combination of plastic and metal, which is really difficult. So really the solution is to change manufacturers, what they do. But I'm assuming also in medical terms that initially, I believe part of the drive for blister packs rather than packets was medically led, that it makes prescribing easier as well. So that's a good example of things where really the most effective interventions are not at our level, and perhaps our role is more about lobbying. So just share as one example. I'm sure there are dozens about just how complex getting some of this right actually is. Scott, I'll bring you back in, and then probably we need to wrap up and move on.
Yeah, thanks, Tim. And I mean, I think it's topical that you brought this today, especially when we're reading the headlines about, the UK no longer being a world leader on climate change and really stalling on that work. So it's incumbent that we really drive it forward. And I just wonder what the sort of scrutiny of your own work, what your own internal scrutiny processes are, just to make sure that you've got a handle of it. And I know part of that is coming to places like this, not for challenge, but to present at the same time. I think, it's clear what you're trying to do is make sure that place-based action is baked in there. And I know my wife's a midwife at Calderdale, and her immediate musings are, around the fact that there's no easy way to get there. That's travel. So more greener transport and active travel modes, making sure they're really baked in, especially for, semi-rural places like ours, where the immediate comeback would be, oh, well, I can't do it, I've got to cycle up a hill or something like that. So really making sure that those conversations are being thought of. So I appreciate this is a massive strategic view, but I think there's some really helpful voices on a local level. So it's just a plea to not lose that, to make sure that those voices, especially people, working absolute nightmarish shifts, and you know what the shift pattern is, it tends to be 7 till 7, and you do 12 hours either way. So making sure that those voices aren't lost in all of this, because there are some voices, and I know they've got their day-to-day and they're getting on with the nuts and bolts of stuff, but actually a lot of them do have the capacity to feed in and want to feed in on this agenda. So yeah, just a slightly personal plea, but really appreciate the work that's gone on with this and the synergy to other local and strategic thinking.
Okay, thank you very much, everybody, for your contributions to that debate, and thank you, Frank, for coming along and presenting that this morning. I hope you found the feedback useful, and I know this will be part of that ongoing discussion and between the various different partnership groups, and we're very happy to have input from yourselves and colleagues into the Calderdale level work as well. So thank you. If I could move us on then to item 7, which is financial sustainability of the voluntary community and social enterprise sector, and invite Julie to introduce this report.
Thank you, Councillor Swift. Hello, everybody. I'm Julie Robinson. I'm the Chief Executive of Calderdale Voluntary Community. I'm part of the wider VSI Alliance. I'm going to do this in 2 parts, if that's all right, Councillor Swift. I don't know how long I've got actually for this bit of a presentation, but I'm assuming that board members have read the report, which was circulated ahead of time. And I thought it might be helpful and useful for us to have a look at the West Yorkshire picture versus place. Just to give a little bit of context as background before I put the presentation I've got. So the financial sustainability report that you've had sight of in the papers, built on 2 surveys that we did in Calderdale last year, so the back end of July, beginning of August, and then we repeated the survey in October through to November, summarising all that data in at the beginning of January. Since that time, I don't know if colleagues have been cited on it, I can circulate afterwards. Durham University have carried out the Third Sector Trend Survey, which is the national picture, which very much drills down to at place and in detail. And I thought it was helpful just to give some context in terms of how many voluntary and community and social enterprise groups we've got here in Calderdale based out of that Third Sector Trend Survey, which is around about 1,500, a little bit more, a little bit less, but that's either registered or unregistered organisations. To give context to that, VAC is a membership organisation, as well as either Strategic Links, Free Tech in terms of infrastructure. And we represent, in terms of our membership, about 10% at the minute, but growing rapidly. When I joined VAC last year, our membership was tiny, less than 30, and we're now heading towards 150. So I'm quite pleased with that progress that we've got going on there. If it's all right, Chair, I'll try and share my screen. I am rubbish at doing this, so I apologise if I mess it up. I might need some help with it. Am I able to share my screen?
Not sure. That's not sure who the host is.
Right, yeah, it's myself. I'm just trying to unmute.
Or I can send it to Janet,
Right.
if that helps.
Yes, I think I may already have it. Can you hear me?
Yeah, I can hear you.
Right. Is it the have a look. I've got a PowerPoint on improving local lives. Is that the one?
There's 5 slides. You might have a bigger one than that. Let me send you this one. Apologies, Chair.
No, it's 5 slides. It is 5 slides.
Yeah.
I'll share my screen now.
Thank you.
Right. Can you see that?
Yeah, bro, thank you. You got
I'll just try and enlarge it.
Okay.
There you go.
Click on slideshow, Janet, and that'll help.
Right, okay. Oh, slideshow there. Yeah.
And then from the beginning.
There you go.
Smash it. Thanks. Can you move to the second slide? Would you mind? Is that all right? If you just.
Yeah.
Okay, thank you.
Oh.
We'll bit through that quickly. Okay. So in terms of looking at this from a West Yorkshire perspective, and actually this comes out within the report, which is place-based, that we produced, let's say, in January. There are 12 areas of challenges for the VCSE sector, and this is relevant whether it's at West Yorkshire level or actually for us here in place. And I thought, Chair, if that's all right, I'd run through the challenges and then the recommendations that are within this. Those individuals that attend at West Yorkshire ICB level have probably seen this presentation before, so I apologise for any duplication. I'm not necessarily going to delve into the system level, but maybe when we get to questions, we can do that. So in terms of the 12 challenges, investment within the VCSE sector is difficult to quantify as it's varied and often non-recurrent. And that's something that very heavily featured within the VCSE sustainability report that we produced. And in terms of recommendations for place, there is a need, and we're doing this here in Calderdale, just to reassure people, developing a place level picture of health and care in VCSE sector investment, and that includes identifying finance leading group to own, progress and develop a shared analysis to inform any decision making. Ensuring that we truly are taking a partnership approach to identifying leads within statutory health and care partners to ensure a place level analysis. Working with VCSE sector infrastructure, so that's organisations such as VAC, but within Calderdale we are part of the wider VSI Alliance, which is the 6 partners, which is quite unique in terms of the organisations that take place in that are the ICB, the local authority, VAC, Forum, locality and West Yorkshire Accountancy Service. So we've got a strong infrastructure in Calderdale. And ensuring longer term plans for mainstreaming where use of NHSE transformation funding has worked well. So that's in terms of investment, in terms of recommendations. In terms of the next challenges, grassroots organisations cannot compete with complex procurement, which lends itself better to large national providers. And I think that very much is a challenge in terms of how we prepare our VCSE sector to be ready and to be tender ready. Some areas retain more in-house delivery within statutory providers. And I think very much so in terms of VCSE organisations. We know our communities, we know our organisations, and we know what our communities want very much on the ground. And we need to take a strengths-based approach to this, don't we, in order to move this forward. Reduction in funding over years due to national cuts to local government, we wholly recognise within the VCSE sector, we're no different than local authority or within health partners. We understand the pressures that there are across the system. But that quite often plays itself out in terms of where contracts are provided, they're provided on that same financial level, but maybe over a 3-year period. So actually in terms of, in real terms, where it's particularly at service level and forward facing, that's a reduction over that 3 years if indeed workforce is to be remunerated accordingly. And system not maximising the potential local providers who can often achieve match funding and added social value. And that's very much in terms of it being place-based. The recommendations for places out of that are co-produced, simplified and inclusive processes which incentivise innovation, reduce the burden on small organisations, allow them to fully demonstrate their social value. Identify additional opportunities to maximise resource and creative approaches to match funding, working in VCSE sector infrastructure organisations, and to develop an action plan to mitigate risks to diverse grassroots VCSE organisations in the short and medium term, which may be disproportionately affected by financial pressures that are carrying out the essential health inequalities and health creation work, including reviewing local mechanisms to ensure funding reaching in these areas. The 6th challenge, potentially some gaps within local VCSE marketplace, meaning that it is perceived as more difficult to communicate local solutions and system priorities. And the recommendation placed within that is to develop an embed process for VCSE sector to share intelligence on health and care gaps that shapes decision making. I think there's a real reality within this. At one point in terms of VCSE, we were competing against each other for contracts and for bids, and now we want a collaborative approach. And I think that is a real shift. Can you move on to the next slide, please? Yeah. In terms of infrastructure, challenges with across West Yorkshire, infrastructure is varied, and the investment in infrastructure is varied. And I've already highlighted how we approach things here within Calderdale, and I'm really pleased. Robin's on the call, I'm sure. that within the peer review, one of the strengths that came out of that was the development of the BCSE strategy, which I know Sian Rogers is leading on, and that will make a real difference here in Calderdale. And then places of lower investment are unable to develop comprehensive networks of BCSE representatives, and inconsistent approach to reimbursement as a barrier to participation for the majority of organisations, particularly from diverse grassroots organisations. And what that point 8 is getting at is representation on boards and subcommittees and structures such as this one, and that here in Calderdale is absolutely some work that we need to do in terms of it not being me that rocks up at every meeting. It needs to be varied across our place, and that's a piece of work that VAC and the VSI are taking forward within this year, and that will be implementing the West Yorkshire reimbursement framework across all places to support meaningful participation from diverse sector voices and proactively identify barriers and enablers to inclusive participation. Just as it is with everybody, I think backfilling your time is difficult, releasing the time is difficult, and that's how do you do that if an organisation is very much voluntary led or it has got constraints around it. The challenges within workforce are no different than in every organisation. I don't think it will come as a surprise to everyone. However, within the VCSE sector, short-term funding arrangements and contracts and grants, which are not uplifted, I've already made this point already, to cover inflationary costs and delay communication around contracts and commissioning leads, does lead to loss of staff. That whole bit about it's a contract that is for 6 months, or for I was talking with an organisation on Monday at the cost of living event, and in terms of their employability advisors, they've been in this situation for the last 3-4 years. So again, a contract coming to an end in November and not yet knowing whether that's going to be renewed. So yeah, the recommendation places look at the investment and commissioning recommendations. Can you take me to the last, well, fourth slide, where it is the last slide? Thank you. And estates. So in terms of the challenges, and that's where within the VSI we work closely with Cass Walker in locality in terms of looking at how we can manage our estates in a different way, community asset transfer. But delays in that can put organisations or projects at risk. And the recommendation for players to review approach and timescales around the community asset transfer at place and consider measures to further support VCSE organisations to take on community assets. And that's very much on my conversations with Sian, going to form quite a large part of the VCSE strategy, which needs corporate reducing. It's just at the early stages. Increased running costs, that is, as for every organisation in terms of utility bills and ongoing costs, it is a problem and is something that is not always taken into account in terms of funding arrangements, in terms of those overhead costs, because that's very much a front facing. And then on data and digital infrastructure, the ability for the VCSE organisation to participate fully in core delivery is being curtailed by a lack of digital infrastructure which talks to each other and shares of data. And I know Kate Horn's leading on that piece of work around the community directory and that wider way of information sharing here in Calderdale. But that sharing is not consistent. Recommendations for place, identify funding opportunities and resources to share more organisation and capture of flow data, to improve access to and quality of information about VCSE sector provision and system partner and citizens through investment and shared digital information infrastructure, including information governance roles, and then to continue to extend the role of VCSE sector players in personalised support, which I know Kath speaks very, very strongly about, which are most vulnerable to digital exclusion. So that's the end of my presentation, Councillor Swift. I don't know how you want to take this forward in terms of questions, or whether that's given a sense of what you wanted.
Thanks very much, Julie. If we can, Janet, if we can just stop sharing the screen so we can see everybody. Yeah. In a moment. Yeah, let's open that up to questions and comments, and then perhaps just if there's anything you feel is missed from the report. So, right, I can see everybody now. Yeah. So, any questions or comments on the presentation so far?
stood in silence.
Yes, no, rather, yeah. Marianne, yes, back on to you. Thank you.
Yeah, just to say that I really welcome the really comprehensive response to the challenges, not just at a system level, but very much at place, clearly around safeguarding adults and supporting adults generally in the population, given the geography and demography of Calderdale. It's always a challenge, and we're very much supported by community and voluntary sector. And I know we've had examples brought to us and challenges put at board level to where funding has really meant that some of those organisations have been really struggling to sustain the services they provide. So really grateful for the thought that's gone into what we're going to do at a place level, not just at a system level. So just a thank you, and we will watch as a board with interest. But thank you.
Thank you. Robin?
Yeah, thanks, Chair. It's Robin Tuddenham. I'm, just those who don't know me, I'm the Chief Exec of the Council and the place lead for the ICB for Calderdale. Just real thanks to Julie for her leadership on this agenda. It's really challenging for the voluntary community sector. We know that the context in which you're operating in, as for all of us in public services, is really, really tough financially. I think there's been a lot of creativity and a lot of kind of collaboration, which has meant that the sector in Calderdale has been more resilient than some other places, and having been in other places, I can really see that. And the ability to have a kind of adult to adult conversation with us as public bodies is really important. So I think we know it's going to not get any easier in the short term, and the legacy that we're all dealing with, like the pandemic impact, workforce retention and recruitment, cost of living crisis is huge. But just to emphasize, I think we are committed to financial sustainability, both as a council and an NHS and our partners, because we do know that the voluntary community sector has a reach into and an impact with our communities in a way that is unique and distinct. And actually, I think really important to put the financial sustainability in the context where we don't always get it right, but we want to use that voluntary community sector strategy to think about how the way we operate and the mechanisms and the levers we pull as a council and NHS as well actually work better for the voluntary and community sector. I think we've made some progress on that in recent years. We work with women and the integrated contract there is an example. But I would just say that, and I mean, Debs and others, Kath and others play a lot of a key part in this. There is more to this than just the money. This is actually about a shift in power and leadership. And ironically, later today, I'm with Julie's in a conversation with New Local with some of us about how we build on that model of community power and leadership and distribute leadership better. So I do think that it's really important to say this is not just a conversation about we haven't got enough resources. It's about putting the resources to the best purpose. And I think we all as leaders, healthcare leaders, absolutely committed to that. And we want to do better and get it even better than it is now. Thank you.
Thanks, Robin. Kath?
Thanks, Councillor Swift. And apologies for being so late. I had two problems this morning, so but I'm here now. And thanks for your report, Julie. I think it's really good. And we know that I'm fully behind voluntary sector and commitments to that. I just wanted to check where the recommendations are being delivered and how they're being addressed, and what support we need, or what additional support we need to lend to that.
Thanks, Kath. Trying to bring Debs in and then come back to you, Julie. Is that okay? Yeah, Debs.
Thanks. Yeah, I was going to make a similar point to Robin about this being we get so much more, so much more from the voluntary and community sector than we buy from them, probably to the scale of tens and hundreds in terms of like the ratio of investment to what we get. And I wanted just to remind the boards of the 4 ways of working in our wellbeing strategy, and think about how we think about the ways of working and how we use resources around those. So one of them is about focusing outcomes, rather than making the services the starting point, making the outcomes the starting point. what that might mean in terms of the way we work with the voluntary sector and the voluntary sector's contribution. One around really shifting the resource to focus more on prevention and keeping people well. And again, how that is cheaper and more affordable than dealing with the consequences of ill health. One around joining things up. So the point that Robin just made about how the voluntary and community sector is really part of our pathways, part of the system and part of the support that we give to people that need extra help. And the final one, which is around us really empowering communities, working with the strengths of our communities and empowering them to create their own health and well-being. And I think when we start to think about those ways of working that as a board we've signed up to, I think it's useful for us to think about, what that means for the way that we, as particularly those of us that are in statutory organisations, we work with our voluntary and community sector partners. And I think we perhaps need to challenge ourselves as around that and around the extent to which we are putting those ways of working into practice.
Thanks, Debs. It's really helpful. Julie, do you want to come back on any of the?
Yeah, welcome those comments from everybody. Thank you. In terms of where this work's going forward, we undertook a sign of the memorandum of understanding with West Yorkshire ICB last July with Rob Webster and Cathy Elliott as a VCSE in terms of that commitment as a start for of different perhaps ways of working, but consistently across West Yorkshire and in place. And we undertook a review of that last month as part of Harnessing Power of Communities Away Day to look at how far we've come and then what next. So very much this is a building picture, sometimes difficult to do in all 5 places, in all 5 same ways, because we are unique and different. And all the things, Debs, that I know you would say here in Calderdale, but that's where that work is sitting. And I sit as part of we're changing our name, but Harnessing Power of Communities board currently. I'm very much the driver there is to take this forward and then that to be realigned in place. Does that help?
Thank you. Yes. Okay. Any more? Is there anything you want to add on the local picture? Julia, has that covered everything you want to say?
I think it's covered it. I hope it's covered it. If not, please drop me a message and let me know, and I will fill in any gaps that there are.
Thank you. Yes, and yeah, feedback. I appreciate your colleagues for the work that's gone into preparing this and the support we get. Thank you.
Thanks.
So if I move us on, then item 8 is increased cost of living, poverty, and health. And Debs, I think you're going to introduce this. I think also Sarah Richardson joined us as well. So he's going to join.
Thank you.
Debs.
Thank you, Chair. Yeah, Sarah Richardson is here, and I don't intend for us to talk a lot in this item. You've seen what we've shared with you all is a presentation. Members of the board will recall we had a board development day where we focused on the increased cost of living and poverty and the action that we need to take and we can take to particularly think about the health impacts of the cost of living and poverty. And what the presentation report does is sort of summarise where we got to, the actions that we got to in that board session, but also what we've also done is summarise some of the information that we gathered, and we were gathering actually at the time we had that board development session from partners about the health impacts of the increased cost of living and poverty, and we got some really rich information that we've summarised in the presentation, Sarah and I, around how the increased cost of living is impacting on our residents and communities. And when we talked about this, you'll recall at the development session that we had, we talked about that responding to the immediate issues is incredibly important, and the things that we need to do that. But we also talked about the need for us to take longer term action to tackle and build resilience to the health impacts of poverty in the longer term, so that we're in a position where we're able to be more resilient to the next economic crisis that we have. And we also reflected, you'll recall, that actually inequalities were increasing. Poverty was increasing before the pandemic and before the increased interest rates, inflation, etc. So there's something about us not just thinking. I think we reflected that we're very good in Calderdale at responding to things and doing short-term work, but that need to develop a longer-term approach to sort of build that longer-term resilience. So what we've done in the papers that you've had is summarised the outcome of the development session we had into an action plan that identifies six priorities that the board identified, and then identifies short-term, medium and long-term actions that we can take as a health and wellbeing system to sort of address the health impacts of the increased cost of living and poverty. So very much the first one of those links to the conversation we've just been having, actually recognising the enormous contribution that the voluntary and community sector and social enterprise sector make in relation to the health impacts of poverty and the increased cost of living, and supporting our residents and our communities. One around supporting people access routine healthcare and wellbeing opportunities and activities. So that's come out really quite strongly of the information gathering, the need for people not being able to prioritise some of those routine preventative appointments, but also those health enhancing opportunities there are in communities, and particularly the costs of getting to those and participating in some of those appointments or activities. The third one is around emotional health and wellbeing, the sort of mental health and wellbeing impacts of the increased cost of living and poverty that's impacting on our communities, but also our workforce and our volunteers as well. And then the second chunk of priorities that we identified in the session were around affordable warmth, increasing access to affordable and nutritious food, and increasing access to income maximisation support as well. So whether that be benefits advice, whether that be support from the Department of Work and Pensions, etc., really connecting that to the people whose health can benefit most from income maximisation. So I'm going to say no more than that, Chair, and we're really interested in having a discussion, Sarah and I, hearing your thoughts and your comments on the outcome of that session that we had, any reflections on the information that's in the presentation that we've gathered from our partners, and really, Sarah, we're really looking to take this forward through the work that we've been doing that Sarah leads around our anti-poverty work.
Thanks very much, Debs. I mean, from my perspective, I think that sort of summary of the six areas of action at the end and the timelines is it's a really good and clear way of presenting that. So I guess part of the question is, particularly for those who are part of that informal development discussion about it, is whether we feel that's really captured the key elements, and whether it helps us to identify and prioritize the areas where we can have the biggest impacts, I guess. I don't know if anyone's any thoughts or challenges. Abby.
Hi, obviously I wasn't part of that whole discussion before, so apologies if this is something that you've discussed loads and everyone knows the answer to. But going through the part, obviously there's great work done getting all the partners together. But with the cost of living crisis, there'll be a lot of people that would never have accessed any of those services before, and may not know where they are. And actually there's a big stigma, isn't there? Just anecdotally, looking on social media, people post anonymously, don't they, about help that they need. How are we making sure that we get the information to those people who may not even know those services exists or have this embarrassment about using them.
Thanks, that's a really important point. Sarah, is that something you want to pick up? Perhaps a little bit about the broader Anti-Poverty Alliance work in that context.
Yes, please, Councillor Swift. So there's an awful lot of work that's been going on, Councillor Carr, with regards to the work of the Anti-Poverty Partnership. Indeed, we had an excellent event on Monday morning with lots of partners coming together to look at this topic around the impact on people's health and well-being. But more broadly, there's absolutely more we can do to make sure that people, as you've said, who've never had to access these services before, know where to go, know to ask, know where to find information out. But what we are already doing is we have a money and wellbeing pages on our website, which are the up-to-date information of what's available and what support's out there for Calderdale residents. It's a really, really comprehensive website with lots of information and links to anything that you might want to know around how to access affordable food, where to get help with your bills, how to look at maximising your income. In the council, we've got our early advice support team, which is a new team that was introduced at the beginning of the cost of living crisis, who are there to give intensive and proactive support to anybody who's struggling, and they deal with very complex issues and support people right through. They deal one-to-one with individuals to support them. Sometimes we can't make it absolutely, we can't deal with everything for people because we know that people are in negative budgets, but what we can do is put them in the best position that we can. And we work with partners like Noah's Ark and Citizens Advice to make sure that people are getting advice, the right advice at the right time regarding any debts that might be accruing. We've issued 2 now, and we're in the process of just pulling the 3rd one together, frontline worker fact sheets, which again are just one side of A4, which go out to all of our partners and our colleagues within the council who work frontline with our residents right across the borough, so that they've got to hand really simple information about where to signpost people to get support. But we're always open to hear of any other frontline workers that we're not getting to, any opportunities to speak to organisations who do help people and are not part of the partnership yet, although we have got lots of them, so hopefully we've caught everybody. But if anybody's got any ideas about where we can get that information out even further, more than happy to hear that.
Fantastic, thank you.
Thanks very much, Sarah. Joe.
Yeah, thank you. Thanks, Ed. I thought this was both a really important, really interesting piece of work, and thought particularly the way you'd set out the sort of looking at it in terms of the short-term, medium-term and long-term actions was really helpful, because it's about meeting the need now, but trying to address some of the systemic things. But I did have a question on slide 58, and I just wondered if you could say what the predicted deaths due to cold homes was based on. Partly asked because it's, on the face of it, it's a very shocking figure. I mean, we should know sooner or later whether or not it transpired. But I think just understanding the robustness of some of this data is really important.
Thanks, Joe. Gabs, can I just bring you in on that one?
Yeah, absolutely. So it's a bit old, the slide. So it was from we put it together probably last October, November. And it came from some figures. It came from looking at the excess winter deaths figures for the UK, looking at that point in time how many people had died of COVID. And then the final slide came from the Marmot Institute, the Institute for Health Equity. They predicted the work that they'd done to estimate how many people would be impacted by cold homes in that coming winter. So it's a bit out of date. Whether that's actually what's transpired, we're expecting the data quite soon now around the excess winter deaths for this most recent winter. But yeah, it came from the Institute of Health Equity, and it was an estimate that they put together. It was me that decided to put it together and show the relationship between how many excess winter deaths we normally get, how many people at that point had died of COVID, and then the scale of the issue in relation to the estimated number of people that would have been impacted by cold homes last winter.
Thank you.
Thanks. Darryl.
Hi, good morning. I'm Darryl Thompson, Chief Nurse at Swift, for those who don't know me. Really interesting paper, Debs, and I guess I'm just trying to, it's invited me a lot to reflect on people who are impacted by more of these challenges than individuals. So the intersectionality, particularly between people with a mental health and a learning disability, as part of their existing challenge, and therefore their existing financial, employment, housing challenges, and activity and occupation. And I guess it's invited me to reflect is how might we work better as a system to perhaps proactively identify where we might need to target.
Thanks, Darryl.
Shall I pick that one up, Councillor Swift?
Yes, yeah, please.
Just in terms of the partnership working that we already have in place through the Anti-Poverty Partnership, Darryl, and we'd welcome you joining, or somebody from your service joining that partnership, just so that we can all be assured that we're doing everything that we can. We have representatives from our adult health and social care team on the Anti-Poverty Partnership, so they are there to talk about the additional impacts that we know that people who've got long-term and conditions and that they are great. Sorry, get my teeth in. They have much greater impact from the cost of living crisis, and so we're looking at, when we look at the housing support fund that comes in through government, we're on round 4 that we're dealing with at the moment. We look at making sure that some of that funding goes directly to organisations that work with cohorts of people who are in greatest need, as the ones that you've suggested there.
Really helpful, thank you.
Thank you. Adam, Councillor Wilkie.
Thank you. And yeah, apologies that I've had my camera off most of the time. I'm trying to look after a poorly 1-year-old whilst being in this meeting. I was looking at some interesting statistics from the Citizens Advice Bureau yesterday, which were basically pointing out that increasingly the types of households that are coming to them for support are people with mortgages, whereas previously it had often been people living in social housing. And obviously that's because of the increase in interest rates. And actually for a lot of people, it won't have actually hit them yet because they won't have come off the fixed rate that they might have been on for the past 2 or 5 years. So I think the pain for a lot of people is still to come, and increasingly so because it's predicted that interest rates are going to continue to rise in the coming months. So I thought that was just an interesting thing to note. The second point I just wanted to raise, interesting to see the trends in winter deaths. Another really alarming trend, which Debs and I have spoken about previously, is the number of children presenting as underweight in schools. I noticed there's a little bit of mention in your slides, Debs, about what we're doing around sort of healthy eating and food and stuff. But I wondered if you could just sort of elaborate just sort of on what the current situation is, because I know we're quite an outlier, alarmingly so, aren't we, on that? Thank you.
Thanks, Adam. Debs, you want to?
Yeah, just on the underweight. So we, in terms of the work that we're doing, we're working on developing a food strategy for Calderdale, bringing partners together. Sarah's involved in that, and we've actually got the top priority, the first priority around children having access to affordable, nutritious and sustainable food as a sort of key priority. In terms of underweight, last year the National Child Measurement Programme data showed quite a significant increase in underweight children in Calderdale, and we then had the second lot of data which showed a similarly. So we start to worry after, when we start to see a trend. We haven't yet had the most recent data on underweight children, but the data that we've done a bit of work to, just because the measuring has been going on in schools. So what we've been doing is just had a look at that, and it does seem to be improved. The situation does seem to be improving this year. So we saw quite a large increase in the 20 to 2021. 2021 to 22, it had improved a bit, but we were still an outlier. And in the 2022 to 23 data based on school years, again, we have seen an improvement in that, but we do need to sort of wait and see the data at the end of the programme once we've got all of it. But I think that sort of real priority. We've also made food and access to food is a key strand of our Healthy Schools programme that we've piloted and we've launched. We've had school conferences yesterday and today with our schools to sort of really talk about that. We're working very much now as well with the school cooks, etc. But this is something that we're really concerned about, and even if the numbers do improve, I think again it's one of those issues that we need to try and understand why Calderdale seems to have been impacted so much, so that in future, next time we have an economic crisis, we are more resilient. Our children are more resilient to the impact of of economic issues on healthy weight. In relation to the other point that Councillor Wilkinson made about about mortgage issues, about who's presenting, you'll have seen in the slides that our partners are very much saying that what we've seen is a greater proportion of people that are presenting to get help, whether that be CAB or the whole range of help. A much greater proportion of those people are in work now than previously. And I think we were talking, weren't we, Sarah, on Monday at the anti-poverty event about, I think, it's really important that we understand that the scale of this is massive, and the scale of the health impacts of the increased cost of living and poverty is going to be long. This is not something that's going to improve once inflation gets under control and interest rates stabilise. The health impacts of this period of a pandemic and then a increased cost of living, I'm afraid, are going to be something we're going to be dealing with for quite a long time. And I think that's one of the reasons that we really wanted to make sure that the actions, it wasn't me, you as a board wanted to really think about those longer term actions and impacts, as well as the shorter term ones. And I think the other thing we were talking about on Monday at the event was our ability, in terms of the support that we can give to people. Quite rightly, we focus that on the people, the very poorest, the people that are impacted the most, the people that are claiming benefits. Our ability to support that broader population is a real challenge. The people are being impacted. You saw from the statistics that we were just talking about on the slide that Joe mentioned, 60% of homes potentially struggling to afford energy costs. This is the scale of this is much greater than the community at the sort of lowest level of income. The population right across the sort of social gradient are being impacted, and the health will be impacted by this. And I do think that's where the things that communities do, the things that our voluntary and community sector do, the things that happen in our communities, and the way that we think as people that sort of provide services, we think about this right across the whole of our services, not just about the people right at the very bottom, if you like, in terms of income.
Thanks very much, Debs. Can I just check, are there any more questions or comments? And if not, we're happy to endorse the action plan now. I think it's really quite important that that's seen to be something that has the support of the Health and Wellbeing Board. I'm getting a lot of nods and no shakes, so I will I will take that as a positive endorsement. And thank you again, and thank you to everybody who contributed to the development session on that. That's helped with that work. So moving us on then, item 9 is a progress update on the health and wellbeing strategy, and I'll come back to you for that one, Debs.
Thanks, Councillor Swift. the purpose, I guess, of this item was for us as a board to give thought to how we want to receive updates on progress with the wellbeing strategy outcomes in this coming municipal year. So you'll recall that following the adoption of the wellbeing strategy, sort of early late 2021, early 2022. As a board, we decided that we would like to receive an update on the progress towards the achievement of each one objective at each of our meetings. You'll recall, and we've done that, we've done that, and you'll be aware of the progress that's been made. So this, I felt that this was an opportunity really for the board to think about what we'd like, we would all like to. How we would like to receive those updates, particular information we would like to receive from each of the partnership groups working on each of those 4 objectives in the coming year. Just a very brief highlight, just as much of a reminder as anything else. You'll remember that Starting Well as undertake a strengths and needs assessment, use that to develop a Starting Well strategy that will need to come back to the board for adoption, hopefully at our next meeting. And we're working on a range of vehicles to achieve that strategy. So, for example, family hubs. In terms of Developing Well, you'll recall that Developing Well partnership has gathered insight from young people using appreciative inquiry to really understand what hope and aspiration means to young people. Julie's been doing presentations yesterday and today to schools about the outcome of that, and it's really exciting and really interesting and really inspiring actually what young people are saying. That's going to inform the development of a strategic plan to achieve that outcome. And in terms of Aging Well, again, you'll recall from the update that we've used appreciative inquiry to really understand the Calderdale that people want to age in, and that's really led to the development of a quite comprehensive delivery plan that the Aging Well partnership is working to deliver. In terms of the Living and Working Well element of our wellbeing strategy, it's quite broad and very complicated. We've obviously got, as you know, it's about good emotional health and well-being and fewer suicides. We've got a comprehensive suicide prevention strategy, an action plan which is being delivered. In terms of people being emotionally well, we know that being active is really important. So Active Calderdale are doing a lot of work around developing a community-led approach to increasing physical activity and also investing in parks and green spaces. We're also working to integrate health and wellbeing support for adults across the voluntary sector, and connecting people to the support that there is in the local community. And then Dan, you're well aware of this work, doing a lot of work across partners to improve adults experiencing complex and multiple disadvantage. And finally, Living and Working Well, we've been contributing very much to the development of the West Yorkshire Fair Work Charter. That's been sort of finalised now, and we are waiting to work with the West Yorkshire Combined Authority on the sort of almost the delivery and the support available to employers in Calderdale to support them sign up for that to that charter. And I think probably there's more that we need to do, I think, to understand the strengths and needs of the working age population. Oh, sorry, the other thing I meant to mention is there's a lot of work going on as well around the transformation of mental health services as well to support people achieve that outcome. So I think that's a very brief update on just a reminder really about the updates that we've had so far this year, and really interested in the board's views about how you want to receive progress reports, what those progress reports, what information you'd like to receive within them.
Thanks, Deb. So last year we kind of went round them in turn and had one on each one, and that may be acceptable again, but we just thought it was helpful to revisit that, as Deb said, and get an overview of whether it should be a bit more focused, because obviously we do have groups sort of delegated to lead the work on this area, but it's important that the Health and Wellbeing Board has an overview and also provides an element of challenge as well. So any views or observations or comments on Deb's summary there? I suppose the balance, the balance to strike is between kind of the regular sort of rolling updates we had last time, but also I think increasingly seeing how main items reports that comes to this agenda, like for example the one we've just had on poverty and cost of living, you know, not kind of seeing that as something separate from the 4 work streams, but very much how the two interconnect. That's probably one of the challenges for me. Is there anything people would sort of like to prioritize in terms of which areas we look at next? I mean, it seemed to me perhaps from the summary Debs gave that perhaps we should look at the final section, and I've gone blank and forgotten what it's called, but basically the working age one, because there's quite a lot in that, so that might make quite a sizable agenda item for the next meeting, and perhaps we might want to pick apart 1 or 2 of the ones in there. Would people see that as a sensible way forward? I'm getting some agreements for that, and I think if people have any other views on things that will be helpful, you know, we do a kind of agenda setting meeting about a month in advance, so it's worth just sort of flagging them up with one of the officers by email. And perhaps also to say if any of the newer members of the group, I'm sure Debs or Mike would be happy, any of the newer members want a bit of a sort of a briefing and an update on the wellbeing strategy as a whole and how it's get there, you know, we'd be happy to arrange for that. So is that helpful? Thanks, Mike. Yeah, so is that helpful in terms of a way forward, Debs? Anything you want to add?
Thanks, Chair. Just the other thing to say, I think we will be in a position where we'll be able to start to look at data, include data, I think, as well, moving forward. I think, as you know, we developed baselines last year, so not every indicator, but some indicators. I think there might be an opportunity for us to time them so that we have actually got some quantitative progress data updates as well about progress with the outcome. So that there's potentially some work that we can do to think about the scheduling, but definitely agree that the biggest challenge, I think, is living and working well. And I think it'd be really useful to get some sort of support from the board and some scrutiny on that at the next meeting.
Brilliant. Okay, thank you. Item 10 is the broader update on health and care priorities, which asks Robin as the place lead for Calderdale to give us.
Thank you, Chair. So just those that are new to the committee, in each meeting I tend to introduce an item just on any burning issues, things that are developing in the health and care system in Calderdale, and set out our response to the priorities. Just in terms of the timing of this, and then others may come in and add to it, although I know some colleagues have had to leave. So just in the context of today's meeting, we do have, just to maybe highlight, there are 2 meetings coming up where there will be a much more detailed outline of our priorities as a health and care system and the Integrated Care Board for the next 12 months. And that will be at the Calderdale Cares Partnership Board, which is in public, which I believe is the 20th of July in the afternoon. And that'll be the first public meeting, I think, chaired by our new chair, Joe Bibby, who's on the meeting today. And following that, there will be an adult health and care, social care scrutiny meeting on the 25th of July at 6 o'clock, which I think is online. So you'll get a much more detailed picture there. So I'm just going to give some highlights, which are some essential things I thought worth you knowing. One is that, yes, it's warm, it's the summer. We used to have this thing called the winter crisis, and then things got a lot better. And then we went into winter again. Well, relatively speaking, given that we probably had the worst, most challenging winter in the health and care system, certainly in my time in Calderdale and in public service, I think it is relatively slightly less demand, but actually not much. And the demand is in all parts of the system: primary care, secondary care, adult social care, children, young people, social care. The system is incredibly busy. I don't think our colleague from CHFT is no longer on the line, but occupancy in our hospital is very high, just about as high as it used to be in the winter, or in the winter it's very, very high. Demand is slightly stabilized in the A&E, but is really, really pressured. Our performance, as you may know, and those of you that have been around a while will know this, we have some of the strongest performance on some of the key conditions, not only in West Yorkshire, but actually in the country, and particularly cancer and waiting times. They are still performing relatively well, but that's really, really challenging. We also have real pressures in the mental health system. I think Daryl's had to go, but the mental health system, both in terms of inpatient and community mental health, is under huge pressure. Just the strikes are very, very fundamentally affecting that. So it was really good news that I understand that the nursing strike issue has been reached resolution yesterday. But on the same day, we had the announcement of the consultants strike, which will lead to thousands more appointments being cancelled if that goes ahead. And that will build on the level of cancellation that has already occurred. So hundreds and thousands of people will receive delayed care if those go ahead. So we do hope that some kind of position of agreement is reached and they don't take place. And we know that's coming on top of the existing strike action that's happened. The other things to say is that our budget position as the NHS and the local authority on health and care is always very challenged. It remains very challenged. Our in-year position so far, which is quite early in the year, is in terms of the NHS particularly challenged, and we will be looking at that and in the next Integrated Care Board meeting next month. In all of this time, I usually talk about health inequalities and the impact and the disparities of the impact across our communities, but I think the previous items and the cost of living one in particular did that really well, so I won't add to that. The other things, and you may have seen some of this, is the combination of complexity of need and demand, workforce recruitment and retention, and budget challenges in our social care provider market are really, 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 really challenging. You have seen that some of our provision is not operating. We have a very fragile social care market, and that's not a unique thing to Calderdale. And that is meaning that some people are having to be relocated into alternative forms of care. And Kath's on the call, so we know that's really tough. So a really challenging position. People are still working really hard. They're doing brilliant things. We are obviously in the process of seeing the impact of the pandemic inquiry. That's going to take a very long time. But I would say that although my fear is that the risk of pandemics returning is still with us, and we are probably looking at 2026, 27 before that inquiry concludes. So there is a really important thread around preparedness, and we are contributing to that, both NHS and local authorities. Chair, I'll probably leave it there, but say that we will have a more detailed update of what we have articulated as our key priorities for health and care at those two meetings. And just say that in that we will be talking about the current sort of developments of the work around the place team and the Integrated Care Board, because there is a reduction in running costs in future years, and we're having to adjust the way that that team is going to need to work to meet those savings. I'll leave it there, Chair. Thank you.
Thank you very much, Robin. Are there any questions or queries for Robin based on that update? So I would encourage people to note and at least look out for those reports on the more detailed priorities as they come forward in July. And and I guess collectively we need to keep sharing with people the messages about using the health system well and the continuing pressures that it's under. And clearly it's very frustrating for lots of us, and we get lots of pressures, particularly over access through primary care. But understanding the realities of the system really important to that. There's nothing else to add on that one. So that brings us on then to item 11. Number of items which were circulated as being for information. Just emphasise that doesn't mean they're not important. They're actually very important. I think they're things where they're dealt with in other places, but we need to be aware of them, and particularly we need an opportunity to say, are there specific implications for us as the systems leaders partnership? The first of those is the Safeguarding Adults board report, and Marianne, you've joined us for this. I don't know if there's anything you particularly want to highlight that, you know, from that kind of system perspective, we really need to be aware of.
Thank you, Chair. I suppose it's tricky really, because this report, I'm conscious now, is we're already writing the last year's report, so it feels like things have moved on significantly. I think to note really that when we were writing this, we were still very much going through COVID and the aftermath of COVID. So we're really proud that actually most of our services in Calderdale continued business as usual, as did the work of the board to gather those assurances and work creatively to try and mitigate some of those risks. I think some of the things that I've highlighted in there, particularly the reform of within adult social care and wellbeing, and the development of a multi-agency MASH, are still very much in train, and there'll be more about that in the next annual report. But also you'll have seen under my comments towards the end of the report, significant investment by the police into the safeguarding investigation team at Calderdale. So 2 sergeants, 25 constables, that's really significant. So I think we were really grateful for how that would strengthen our work in safeguarding. So some really positive things. We still continue to work through the impacts of COVID, now the impacts of austerity and the fuel crises. You know, Deb's has already presented on that, but I think we just need to keep everything under a really watchful brief. You know, significant change within health and under the ICS. So again, how that all works at place and at that broader footprint is something really in keen focus. So a challenging environment which to operate. But so I think it's more important that we work not only as a board, that we join up with the other boards that share some of that agenda. So I welcome the opportunity to review the agenda for the Health and Wellbeing Board and the Calderdale Cares Partnership, and to work across the boards really to make sure that we do keep our adults safe in Calderdale. So unless anybody's got any questions, that's it from me. Please look out for our new report as that comes through, and will be shared with scrutiny as well as at the board. But happy if anybody's got any queries to answer them now.
Thank you, Marianne. Perhaps just responding to what you said there, and again, this is probably more about this year's report and current work going forward than this report. I was just struck by the point you made about the cost of living. It just occurred to me that we always think in terms of austerity and cost of living about the potential risks in terms of children's safeguarding and the pressures on families, and perhaps don't think enough about parallel pressures on adults. Certainly that hadn't really kind of occurred to me to think that through properly, but I guess there are risks there, and that's something that's coming up. And I suppose the other link to make is just going back to Robin's update and the issue about the fragility of the care market. I mean, that's kind of, you know, in very practical terms, I think some people will be aware, you know, we've seen examples of care homes closing. We still have this, what seems to me this awful loophole in the law that effectively care home residents have have less rights of residence than a tenant on a short-term tenancy, which is just appalling. And I'm assuming that would be something you're looking at, and certainly want to look at how some of those closures are handled, perhaps.
Yeah, definitely. Yeah, definitely. I know Kath will want to come in on this one, but yeah, you know, a significant risk that we recognise as a partnership is that the fragility of the care market and the impact that's having. So I'll let Kath come in and speak in more detail about that. Yeah.
Thank you, Kath.
Thanks, Marianne. And apologies, I'm not being able to keep my camera off, but my connection is terrible, so I hope you can hear me okay. But yeah, just on that point, and I suppose the general point about the reports, that I do think the board is a very strong board. We've got very strong leadership in Marianne, but with all partners as well, and I think that continues, and that kind of supports the work that we're doing and that we need to continue to do, and also to manage those risks across the system. So definitely the cost of living crisis does have an impact on older adults, on people with physical disabilities, on people with mental health problems and learning disabilities, and all of which can put people at risk of harm in terms of the safeguarding response. So we are seeing the reality of that. In terms of the fragility of the care market, particularly the care home market, that again, that is very real, and our social workers work really closely with our providers and also our commissioners. We've got someone on the call here, work really closely together to make sure that we've got that safeguarding and quality and safety joined up. That's all those issues are kind of joined up, and we have a very robust response to that. Having said that, we had a compliment of a social worker yesterday that came to my attention, which was lovely, that she'd worked with this family and this particular person in a very compassionate and really skillful way, but it had been that person's third move to a third care home in a very short space of time, and obviously that does have an impact. So that wasn't a safeguarding concern, but it was a concern around the quality and safety and also people's experience. So we do have to be extremely mindful of all those issues. Thank you.
Thanks, Kat. Sarah?
Yeah, just wanted to come in and provide some reassurance around safeguarding and the links to our anti-poverty action plan. It was something that was identified through the partners that was missing from the previous action plan, and a survey of partners right across the system around what were they seeing around the impacts on safeguarding that came out of the cost of living crisis, and we've used that to develop some new actions that have gone in, and Julia has been really helpful to us in pulling that together, as you'd expect, Marianne. So those are in there, and we will be accountable for delivering on those, just to provide a little bit of reassurance to the board.
Thank you, Sarah. Okay, so thank you, Marianne, again for your time, and welcome. Happy to receive the report, and please pass our thanks on to Julia and colleagues for the work that's gone into it as well. Thank you.
That's great, thank you, Tim.
11B, the Better Care Fund year-end report, again largely brought here for information and awareness, because we are accountable for the Better Care Fund. Graham, is there anything specific you want to draw to our attention?
Thank you, Tim. Yeah, I'm Graham Mosley, Senior Commission Officer for in Adults Services and Wellbeing Directorate of Calderdale Council. Yes, Tim, just to draw people's attention, the Adult Social Care Discharge Fund will now form part of the annual return and the Better Care Fund plan. So you can see within the annual return there that they've now appendices the discharge funding, so we have to account for the spending and allocation of those funds. That fund has increased for this financial year, so it will be incorporated into a new Better Care Fund plan, and that will be brought to the board in August's board meeting, so that will be brought for approval. So it will include the discharge funding now, which it hasn't previously.
Thanks, Graham. Any questions or comments on the plan? Are we on the year-end report, or are we happy to receive that? Okay, thank you. So happy to receive that note. We will get that item in August. The Calderdale commissioning strategy is Robin, is this something you're commenting on? It's largely here for information at this point, but
Chair,
Not
it's
that I'm aware of,
myself.
Chair. I don't think
It's
so.
myself.
Yeah, I think it's Jane.
Okay, apologies, Jane. Yeah,
it's fine. Thank you, Chair. Yeah, just to say that the strategy document has gone through both adults and children and young people's Directorate Management Team meetings, so it's been approved through that internal governance process. So it's here today just for information. It's obviously a long document. I'm hoping people have taken the time to have a look at it, even if they've just kind of skimmed through it. But the previous strategy that we had came to an end. That it was previously focused very much on adults commissioning. So this document aims to be focused more across the board on children's and young people's and adults commissioning processes. What I've tried to do is also align it to the health and wellbeing strategy. And to kind of align the different elements of commissioning to the different health and wellbeing life stages. So we've got that strategic connection as well, and people can see that golden thread. It is outcomes focused, and I know Julie referred to that earlier in her presentation. And that is one of the things that we've tried to do through this strategy and the work with the commissioning team and our partners. We've looked at some new integrated commissioning principles as well, and I know that was one of the things that Julia also referred to in her slide. So a number of things I think that have been mentioned previously are already encompassed within this new strategy. It's for the next couple of years up to 2025, so it gives us an opportunity to see some of the impacts of the different elements of commissioning and increase robustness of those commissioning processes.
Thank you very much, Jane. Apologies for not coming to you first. Has been circulated. Can I just see if anybody's got any questions or comments on that? Debs, yeah.
Yeah, I was just thinking about the item that Julie did at the beginning of the the very beginning, thinking back, the issues in relation to the sustainability of the voluntary and community sector. And I was just wondering, Jane, was that I may well have missed it and it may be there, but something about our statement of commitment to the contribution that the voluntary and community sector makes to the delivery of these outcomes. It may well be there, but I couldn't see that. And I guess yeah, it'd be interesting to know if that's something that was considered, that sort of explicit statement that we might want to make if we think about commissioning as a way that we invest our resources, and perhaps also something about the contribution of the investment to social value and to the sort of local economy as well. Just interested if those are things that had been considered.
Thanks. Jane, do you want to come back on those? There's something you want to take away? Right, you're on mute.
Sorry about that. Yeah, Deb, there is reference to partnership with VCS organisations in the strategy, and obviously a lot of the services that we deliver in partnership with VCS organisations. So it's very much at the heart of everything that we do in commissioning. In terms of what you were asking around the other elements, I mean, in terms of how we commission, we engage with all stakeholders, particularly service users, to ensure that we're getting those specifications right. Social value, climate change, Vision 24 are all part of our commissioning process and are embedded within our commissioning strategies. So I think we've got it covered, but probably not specifically in the detail of the strategy, but within those commissioning processes.
Just done the same thing. Okay, if there's no further comments on that, then we're happy to receive that. And then finally, perhaps we can just note the forward plan and the suggested agenda for the August meeting, which looks fairly substantial again. And with that, I'm going to thank everybody for their attendance and contributions this morning, and I'll draw the meeting to the close. So thank you very much, everybody.
Thank you. Bye.
Thanks.
Thank you.